I'm going to talk about tennis elbow. In medical terms, we refer to as lateral epicondylitis, which mainly affects your lateral aspect of your elbow. When there is middle, it's known as golfer's elbow. So this is caused due to recurrent use of your elbow, most commonly seen in tennis player. It is proven by many studies that tendon stiffness can be reduced significantly by eccentric contraction where there was no change by static stretching. What I tell to my patient is that no matter what you do, your degenerated tendon cannot be repaired besides surgery or tendon graft. So you have plenty of good tissue which you can work with. So don't lose your hope. There are so many eccentric exercises, strengthening exercises, loading and offloading exercises which I can help you with. So I don't recommend stretching because this is usually caused due to your stretching force where your tendon is unable to handle the stretching load caused by your muscle. So what I recommend is loosening up this area and massaging it and going with the eccentric exercises, and make sure while doing the massage not to do in the bony areas because it can cause more inflammation and soreness. What I want you to do is 5 centimeter above or 5 finger above, you can loosen up this area wherever the knots are there, then slowly do a ischemic pressure technique. I want you to see for knots or trigger points where you find there is a tightness in this area. So I want you to hold it there for 1 minute, and along with you can do the movements with your wrist. So there is a contraction occurring in your muscle, along with there is a pressure in that area. So you can see after 1 minute it has come down to 10% or 5% decrease. If it has not, then you can go search the other areas and loosen up these areas. Make sure you do not rub the area where there is bony prominence. So I want you to loosen up the area where there is muscles, or you can find a trigger points or release. You can release these areas, hold it, release, because you know your body well enough. So you know how much pressure to apply. Once you get the knot, you can do here. So this is the eccentric contraction forward exercise where your arm is gonna be in this position here and moves away from your body with 40% force and the other arm with 20% force. So you're gonna stretch it here. Do the eccentric exercises in this position. And once you're getting the angle right and good at it, then you can slowly increase the angle of your elbow. Make sure to maintain the force and the load. And this is not same as stretching, because while doing the stretching here there is no change in the length of the muscle. While doing this eccentric control, there is a change in the muscle, and the tendon gets the control, and the tendon is controlling the length of the muscle. So you should do this according to the tendon rehab protocol. It usually takes 12 to 13 weeks, and the pain level should be below 4 on the scale of 10. So this is an eccentric control which you can do with a water bottle or a dumbbell if you have at home. You'll be in this position. The forearm muscle is a 2 joint muscle. It controls the wrist, along with it controls the elbow. So while for this exercise you'll be extending your elbow here, then at the end range you'll be rotating your wrist outward. Again you'll be in this here. So it helps your tendon to load the weight, and it gives control for your muscles. So make sure you're extending your elbow, and at the end range you're rotating your elbow outward. So there are many exercises you can do as similar to this.